What are those top 5 reasons where you can say that she has a higher chance of having a miscarriage?
So you can broadly divide them into very quick things. One could be genetics.
Correct.
You can't change your genetics, but you can test your genetics.
Right.
It will give you an idea if you're going to have future abortions.
Got it.
You can't change the genes, but you can test your embryo before putting it inside. So that is some correction which you can do.
Right.
Second thing which is nicely correctable is anatomical problems. Very commonly you can see polyps, fibroids, septum inside the uterus, all these types of things. Easily correctable. You can do a small quick corrective surgery and usually people will have very healthy pregnancy outcomes after
Fantastic.
that. Third and fourth would be predominantly related to biochemistry. That means somebody could have elevated levels of, clotting agents in their bodies. Somebody could have low levels of, anti-clotting agents in their bodies, easily manageable. You can give them simple drugs like heparin, ecosprin, and the patient will do very well in their pregnancies through this. One more interesting and important cause, especially in India, and completely correctable, is endocrinological causes. You will have a lot of women who have never been tested for any endocrinological workup, let's say hyperprolactin levels, hypothyroid levels.
Correct.
They have elevated levels of thyroid. They simply didn't know about it.
Right.
Correct. They got pregnant, they got married, life is going smoothly, nothing came to their, site. They had 2 abortions, they got tested for a thyroid. They knew that they require thyroid correction. The thyroid is corrected.
So these are things that can very quickly be checked before you get pregnant.
Absolutely. And that's why it's all becoming a very important part of preconception now.
Right.
That when somebody's planning conception, planning the perfect conception, as Jaideep sir mentioned.
Doesn't exist. But one quick question on this, because you spoke about thyroid, gestational diabetes, high blood pressure, very common nowadays during pregnancy. Has the rate gone up over the years?
I would say surveillance has gone up.
Okay.
Apart
Awareness has gone up.
So we have become better at picking it up very early. Like these days, we are predicting it at 12 weeks, ultrasounds and biochemistry.
And there's nothing to worry, right? Like if you have some of these things, it's okay. Absolutely. It's very correctable. Women don't have to panic, right?
But even if you tell them not to panic, they will panic.
Yeah.
Because the tagline is to panic.
Yeah. But in your medical opinion, in your expert opinion, developing this during pregnancy is normal and not to cause panic.
So for thyroid, for example, you could have thyroid disease, but as long as it's under control,